Hi there, and welcome back. Today I'm joined by Ajay Prasad, founder of Repugen, a reputation management company that helps healthcare providers strengthen their digital presence by collecting and managing patient reviews. In this episode, Ajay and I explore how online reviews can help you build trust, attract more patients, and even increase the value of your practice if you decide to sell later on. We cover lots of practical insights, including the best time to ask for reviews and how to ask in a way that feels natural, what to do about negative reviews or spam reviews, and whether they're really as damaging as they seem, why it's so important for your online reputation to reflect the quality of care that you actually provide, what many practitioners get wrong about reputation management, and a reminder that most patients won't leave a review unless they are asked, but many are happy to say yes when prompted. If it's been a while since you asked for reviews, this episode is your reminder. Social proof matters, and reviews are one of the most powerful ways to build it. So, if you're in a country where healthcare providers can ask for reviews, because I know that's not the case everywhere, then I hope this conversation encourages you to start asking regularly. Today's episode is sponsored by AcuHub. AcuHub provides remote reception services specifically for acupuncture practices. I use AcuHub in my practice and I love it. With AcuHub, you can rely on a dedicated US based, highly trained receptionist to answer your incoming calls and inquiries, schedule appointments on your EHR software, onboard your new patients, and answer questions specific to your practice. Their motto is Be Like an Elephant because they have big ears and big hearts, offering a compassionate first point of contact to all of your callers. AcuHub was created and is run by successful acupuncturists just like you who understands that too many small clinic owners lose their precious time to the demands of administrative work. AcuHub alleviates this burden, letting you focus on what truly matters: your patients, your family, and your personal life. They offer month to month services with no contracts or termination fees, with rates between just $5 and $8 per hour, depending on the size of your practice. Save time and money with your own dedicated AcuHub receptionist. Visit acu-hub.com to learn more, and I'll put the link in the show notes. And if you have questions about AcuHub, you are always welcome to email me about my experience at michelle@michellegrassick.com. All right, let's dive into this episode with AJ. Hi, AJ. How are you today?
I'm doing well. How are you, Michelle?
I'm doing well. Thank you so much for being here with us today. Before we dive in, I would love to give you the opportunity to introduce yourself.
Sure. I'm Ajay Prasad. I founded and I run this digital marketing agency called GMR Web Team. What GMR Web Team does is digital marketing for healthcare providers,
Mm.
doctors, chiropractors, sports acupuncturists, and urgent care centers. And we have clients all over the country.
And I found you through, I think it's just one of your websites, Repugen.
Yes, so I will tell you. So Repugen was it's almost like you can say came as an offshoot
Mm.
of GMR Web Team 6 7 years back. We realized that no matter what you do in digital marketing, people will find you, and before they even contact you, they will check your reviews. And if your reviews are bad, no matter what you do, no matter how effective is your marketing, you're not going to get the patient. And in those days, frankly, there was nothing, no automated system for review generation. There were a couple of accounts that came in and I turned on because I said, your reviews are so bad that I don't think that I can help you. And so there was one particular client and we had a meeting and I looked and I said, I don't think I can help you. And it's like, why? It's like, you have really bad reviews. It's like, what do you mean? So I just pulled it on my smartphone actually and showed it to her. And she knew all the people. It's like, this guy is good. And then she gave me a big lecture about how they have been in business for 25 years. They have patient that has been with them for 25 years. There's all this loyalty. And so my question to her is like, wait a minute, then in that case, how would someone know? The story that you just told me, I trust you. So we created some manual process for requesting everyone to write a review. It worked very well for her in no time. So I did that for a bunch of other existing clients and the new clients. And of course, we had some level of, you can say some people will execute it properly, some won't. So it was not working. But what became very apparent to me also is what the review says about them compared to the actual patient satisfaction was there was absolutely no relationship. And it's very logical. When you go to a doctor's office, you seldom, unless you thought that you have a cancer and doctor says, no, you just have a headache, right? Maybe you will come out excited, but there's nothing that will you come out and people write review on their own only if they have a bad experience or they have a fantastic experience, right? It's very hard to have a fantastic experience, even though you like a doctor. So there was a big mismatch in terms of what the actual patient satisfaction versus review. So I was looking for a solution. There was nothing there. I do have a team. So, we have a fairly technology based, even my marketing as a platform based marketing that we do. So I asked them to create, the basic software, you can say, just write it and to check, ask people for basically for their experience. How was your experience? And would you please share that online? Now, how the experience was, they had to rate it. And you could literally see, especially the new clients will come in, they would have horrible review compared to, for example, my existing clients. But really, the actual patient satisfaction was not much different because now we are monitoring every patient, right? We are asking. So that's when I said, okay, just to take care of this marketing for GMR Web Team, I have to have a platform that can be automated because I knew that people were not executing it. So that's where the idea came, and luckily around the same time, one of my client who have like this is a large organization in Orange County, and they have maybe close to 400 providers. They always ask us to market their new providers, right? When they hire a new doctor, I mean, I don't know if you are aware or not. So typical practices, they hire a doctor on a salary, but very soon doctors are supposed to start generating their own patients so that they are paying for themselves and more, which goes into the big bucket, and then there's a distribution right to the partners. So we were doing that, and then of course I use this as one of the key tools for marketing. And they came to me and said, you know what, I don't need marketing for 400 doctors, all of us, but I need this. Can you handle this for me? So that was, we just from a simple software, we had to create a platform. Then, since then, because we are a marketing company, so we have added a lot of other features to help healthcare providers. So now it has become like a separate platform, but it is really one of those offshoot of GMR Web Team. And by the way, we don't do digital marketing unless our client agree to also manage reputation because we know it's not going to be effective and they are going to be unhappy with us. So once in a while, someone will come and say, no, 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 I don't want, I don't want to measure patient satisfaction. I don't need any reviews. And then we just always bow out and say we are the wrong company because that's really part of our process for marketing. So that's how Repugen started. And since then, it has become a kind of, you can say, taken a life of its own. So that's how you found Repugen. And Repugen, in a way, is interesting because it is 100% software based, technology based. So it has a almost like an automated system. Once someone signs up and sets up, then all they do is they see the output, they see more reviews, they know which people had bad experience so that they can reach out to them and try to figure out what happened. They can get the analysis of the patient comments to know what are the drivers of patient satisfaction, dissatisfaction. They can just reach out and send them happy birthday or some patient engagement.
And I really love from your Repugen website that you talk about helping people align their digital reputation with the care that they actually provide. Because I think you're so right that if patients are left to their own devices, it's only the extremely unhappy and the extremely
Yeah,
happy who are going to leave reviews. And honestly, the unhappy people are so much more motivated to say something.
you are so correct. And you have to really blow someone. out of the water in order for them to be so excited to write a positive review. But on the other hand, the moment you ask them and say, "This is Michelle, Dr. Michelle, can you share how was your experience?" A lot of people will do that, right? They will
Mm-hmm.
say, "Sure." So they do that, and then all of a sudden you see the reviews getting aligned to the actually patient satisfaction. And by
Yeah.
the way, I'm not saying that every provider we have gotten had wonderful patient satisfaction. But in that case, they knew that, okay, here's a problem. Patients are not happy. That's why my reviews are looking bad. But the beauty is that they would also know why they are not happy so that they can address that, uh, the problem.
Yeah, which I think is a really important piece. And it's nice to be able to catch an unhappy person, figure out what the problem is before they decide to write a review. It's really pretty
Yeah.
important.
And by the way, obviously, I wish that I was so smart that I thought through all that process. But I don't know if you are aware or not, but a portion of providers' compensation from Medicare and now health insurance also, it depends on the patient satisfaction. The Medicare, because they are the biggest payer, they have a very extensive process of patient satisfaction and measurement, and they have their benchmark, right? So you have to meet those benchmarks, otherwise you get penalized in terms of lower payment. So now several of our very large clients, for them it's a big money. When you are billing $1 million and you lost 2%, it's
Wow.
like $20,000 you lost. It's not such a big deal. But now if you have like this client with 400 providers, so when they are billing $500 million, that 2% becomes like a 10 million that's in the bottom line that they lose, right? And the large healthcare group, you'll be surprised, they don't have a huge margin. It's not like they are raking in money. So it becomes a big deal for them. So what they are noticing is, so there is the government survey that goes out typically 2 weeks after they have seen a patient. So because we do this survey every day, they have seen. So if someone is unhappy and they have addressed it, they rank them higher on the government survey. And they have told us that quite often they don't know what is Repugen, right? But they would say, I had a bad experience, but actually someone from the office called me up and addressed it. So now I'm happy, right?
Yeah.
And they get overall higher ranking. So it helps them also with the revenue. So everything is so interrelated. And as you know, the patient satisfaction is becoming like a bigger and bigger deal,
Yes.
being a provider yourself. So you know that.
Hmm.
Uh,
Yeah, I would say
so
that more than ever, patients expect to be treated like consumers. And it really
yeah,
is about the customer is always right, has become a
yeah,
real thing for medicine, which I don't think it was the case in the past.
exactly. I used to be in the consumer market. I'm a marketing guy, and just looking at me, you can tell that I'm 100 years old. So a long time back when when I was in the corporate world and marketing, consumer marketing, customers always right. And I also used to tell them that one unhappy customer will go and tell 10 people about their bad experience. 10 happy customers, if you are lucky, will tell one person. So
Yes.
if 10 people who are happy go out happy, you are lucky. If all 10 combined with, there will just one person who will hear about their good experience. So that is how important it is to manage the customer experience. Healthcare was not like that.
Right.
Doctors were always right. You just listen to them and you do it. But obviously, I think internet has a lot to do. All the information people are getting, and the patient go very informed. I'm from India originally, right? I came here long time back to do my MBA and just ended up staying here. But I have my uncles who are doctors there, and I still visit quite often. It was funny because I would sit in the clinic, and now I'm very interested in the healthcare process. So I'll sit in this clinic, and he's a primary care physician, and so if someone comes in and says, "So, doctor, I did that, I checked it, and my blood pressure is fine, and I did that, and this is okay, and this is okay, and this, I'm having the problem." And last time I was there, he looked at him and said, "You already know everything." She said, "But so as a result, I think I have XYZ, right?" And he looked at him and said, "You already know. You have already done everything. You already know what you have. So I'm sure that you have checked what the treatment is. So why are we here?" And I'm like, when he left, I told my uncle, you should have congratulated him and said, wow, I'm so glad you are informed. And then reach out and say, what is your concern? He just totally dismissed him. You have already know what you do, so why are you wasting your time and my time? So those things are gone. Patients are more informed about the issue. I don't know anyone with any specific problem visits a provider without doing some research, right, online, either extensive or basic.
Yeah. I one thing I'm always recommending to my audience of acupuncturists is to have some sort of system, like put it on their marketing calendar to ask patients that they think are having a good experience to leave a review. And it is a little tough when you are doing it and it's not automated to get people to
Yeah,
comply and to be really consistent. But I feel like the ones who are relatively consistent in asking, they end up with so many more reviews
yeah,
overall compared to the people who are doing nothing. So they like quickly
exactly.
outpace their neighbors and it makes them look fantastic on the internet. If they've got 35 reviews and everyone else has 3, they become
Yeah.
the easy choice.
Yeah, exactly. So when I first started, so when you go to a typical doctor's, it's a little bit even more complicated because there are so many physician review sites, it's not even
Mm,
funny. But there are like 7 that we have selected, and ZocDoc is the 8th one, but ZocDoc they have their own system. And not necessarily everyone goes to Google or Yelp or, some people trust WebMD more, right? Some people have GradeMD. There are so many other platforms. And if you, for example, even if 20% of the people are checking health grades for the review, if you don't have review there, you miss out on that 20% of the potential prospect. So definitely you are right. And by the way, one thing that you may want to also tell your audience, and we do very extensive research, Michelle, every year, no review is as bad as bad review. If someone has 0 reviews, it does not instill any confidence in the patient to say, okay, I want to try this provider. Obviously, no is better than bad in the sense that, well, bad is bad. But if the purpose of the review is to assure patient that, okay, he's at the right place or she's at the right place and select that provider, it won't happen if there's 0 review. So,
right.
so that's a pretty major factor that people are not generally aware of it. You would be shocked how many providers still don't have any review. If I had to guess, probably like 50% providers don't have reviews.
Wow.
And
Yeah.
they don't know what they're missing in a very big way.
Yeah, I guess I never really thought about that, that having no reviews is just as bad as having a bad review. Because, like you said, it really is about helping the person know that they're making the right choice. And if there's no
Exactly.
data, how can
Yeah.
they don't know anything, really.
Yeah, exactly right.
Mm. So, okay, I have some questions for you then about bad reviews,
Mhm.
if that's okay. And I have an example for you. So, a friend of mine is an acupuncturist, maybe 30 minutes from where I live, and she's my acupuncturist. We do a trade. I love to go see her. So, I know firsthand that she is really good. She has extensive training after acupuncture school. She's an orthopedic acupuncturist. She's fabulous. She has one one-star review on her business, and that is her only review. And that is, I researched because I was so mad when this person put a one-star review, especially because I'm like a marketing obsessed person. I was like,
Uh-huh.
that is wrong. Let me dig into this. So, first of all, she said, I've never treated this person in my life. I don't know who this is. So, I looked
Mhm.
up their name and they live like 3 cities away. I found them on Facebook, or not 3 cities, 3 states, right? So, they live like 5 hours away. So, I'm like, I think this is spam. I think this is a robot. So, I have put in to Google several times. I marked the review as spam. I explain why, but nobody really works at Google. There's no customer service. So
Yeah.
I don't know what to recommend to her how to get rid of it. And it really does not match the care that she provides because she's not even worried about it because she gets so many internal referrals because people are
Uh,
so satisfied, but that is not represented in her online reputation. So I'm really curious, is there a way to get rid of that kind of review, or should she just begin collecting positive reviews and not even try to get rid of it?
Yeah. So all these platforms have a protocol, but as like you said, you do that and you have no idea when or if it will be addressed, right?
Right.
Because Google doesn't make money on the reviews, so
Yeah.
so they're like, hey, it's your problem, sort of thing.
Right.
So we also manage our clients' bad patient reviews. Sometimes it is the real problem, and then there we will just simply say, "We are very sorry you had this experience. Please reach out to on the office directly, and please don't post anything about your personal the treatment." Right? It's the HIPAA thing. It's
Yeah.
not a good idea. You can post whatever you want about you, but we cannot, as a provider, as a consumer can post whatever they want. Provider cannot even confirm it. So just say, call us.
You would recommend that they respond to the review by saying that, please call us so that we
Yeah, sorry
can.
about your experience. Please call us. Right.
Gotcha. Okay.
Uh,
Yep.
so that's if it's a genuine bad review, right?
Right. Yeah.
So in this particular case, like your friend, if it is really wrong, so after you did the protocol, I would respond to it by saying, I'm so sorry, you are not my patient because you live 3 states away. Please remove the review. All you can do is please remove this review and sort of be done with it. Because
Okay.
that way, what will happen is if someone checks that review, I mean, one review is very bad anyway. So if someone checks that review, then can see that, okay, it's not a doctor issue. But one thing that I always tell people that no matter what you do, we still have about 3% of the, after doing millions of surveys now already of patients visit,
Mhm.
about 3.5% of the patients will have bad experience. So no matter what you do, and even we identify it, sometimes they will reach out to patient is still very angry, they don't want to deal with that, and they move on. So I always say that you will always have one or two bad reviews. People understand.
Mhm.
But that's why you want to have a lot of good reviews so that, frankly, if someone has just everything is 5 star, even that is not believable. In modern world, people start to think they must be fake.
Mhm.
So about 40% of the people, when they see it under 4.0, they just move on. They don't even check. If it is 4.4 and up, then at that point they will start reading the reviews and see what it is. And
Interesting.
so that's the reason I always say that responding to review is very important.
Okay.
And you have to do it in a HIPAA compliant way, but yes, it's very important to respond.
Okay.
And so my suggestion to your friend would be enter into the process and start getting more reviews. It cannot hurt you, right? I mean, she may say, "Hey, I don't need it," but how can it hurt? I mean, I went to my ophthalmologist, I will tell you recently, where he's in his probably late 60s, early 70s, fantastic ophthalmologist, right? Very well known in Orange County, had really bad reviews. So I remember, 6, 7 reviews really bad. So I was sitting with him and I'm like, Doctor, have you checked your reviews? He's like, yeah, well, people can write whatever they write. I'm like, but you should manage it. He's like, AJ, I've been doing this practice for a long time. I know what I do. I know I take care of my patient. So I don't think I have to manage my reputation. You cannot argue with them. I know my question to him still was, how does it hurt you to
Right.
manage it and have people saying good things about you online? But some people just, you have that. That's one of the healthcare provider's ego, right? It's like, I don't need any
Uh,
support. I'm very good.
yeah. Someone mentioned to me recently that if you are thinking about selling your practice, that your online reputation has become an important part of how they value your business. And so
Yes.
this, if your ophthalmologist is approaching an age where he might want to retire and maybe sell his practice to someone, then it would suddenly possibly be very important to him to have his really good patient satisfaction actually represented on the internet.
Yeah. It is dawning on them, right? So we started focusing on patient satisfaction, what, in 2018 or so, right? We created Repugen and all. And I don't think that until a couple of years back, the providers got that message. Now we see, so before what used to happen, that primary care physicians will contact us, right? Mostly
Mm.
because, they are kind of, competing for new patients, right? With other primary care physicians in their area. And they understood that, okay, reputation is one of the, all these specialists said, used to say, you know what, I don't care because patients are not. I don't get patient directly anyway. It
Oh,
has to
right.
be referred right by PCPs. Now all of a sudden, last 2 years, every group, I would say, if not every, 95% of the people who contact us, groups who contact us for using Repugen, I can tell you are specialists. Because
Mm.
what has started to happen that now the PCP will say, oh, you have the headache. I think it could be because your eyesight, whatever, right? So I suggest that you go to ophthalmologist and they refer to ophthalmologist. Guess what the patient do? They will check the reviews. And if the review is bad, then they will come back and say, I don't want to go to this doctor. I want to go to this. And I have several instances of PCPs telling me this. So much so that I have the PCP group, a very large group, about 600 providers in Orange County. And their system is that now they have a very systematic way of recommending. They have a selection criteria for referral specialists where they have to have a minimum threshold for online reviews, online reputation. Otherwise, they would not, because it becomes a problem, and also you lose some of the patient's confidence, right? You refer someone, and patient thinks that, oh my God, he's such a horrible doctor. Why did you refer to me? So
Right.
I'm seeing that. I'm seeing this cardiology, oncology. I mean, all the specializations are coming in. It's like, hey, you know what? We need to address our reviews. They must have. It's not an option anymore, Michelle.
Yeah, I would definitely agree with that. And it's interesting you pointed out that it's sort of like if you refer a patient to someone who has poor reviews, it also can reflect back on you as a provider. And the other
100%.
day, I had a patient who's been coming to see me for a little while, but she is traveling like 35 minutes. So she actually lives in the town where my friend practices. And I was like, if it's too hard to get here, because we sometimes still get snow in April, you could visit my friend. She's outstanding. And I was like, but okay, if you Google her, she only has a 1-star review. I'm like, I just want you to know that that is not at all representative of the kind of care that is a spam comment, blah, blah, blah. But I felt like I knew they were going to look her up. And I
Yeah,
had to
exactly.
convince them, no, she's legit. She's marvelous. So it's funny because I don't know if she listens to this podcast, but I will get on her case about collecting more reviews. I'm really curious, is there a best point in the patient journey to ask for reviews? As acupuncturists, most people recommend coming 6 to 8 times before we reevaluate
Yes.
and say, can we spread these treatments out? How do we know when is the sweet spot for asking for a review?
So first is the first visit you have to get to know what was their experience, right? And based on that, if they write a review, it's wonderful. And the second is at the end of the whole process, right? If there are eight
Gotcha.
visits, then after the eighth visit. So what you may want to do is that after the first one, not request them for a review. For example, Repugen. If you added the patient, but you said, you know what, I just want to do a quick survey after the first visit, but I don't want to request any kind of review. But then you get a good feel for, okay, so that is a good feedback. It's an internal survey, and you are asking to write a comment. You can say, can I share this on the website? And then at the end of the treatment, you definitely want to ask for what was the experience is, 2, 3 question survey, 4 question survey, and then request them to write a review. So you really want to get a feel for, okay, this patient is happy,
Yeah.
is going to write a review for me. So what Repugen has, interesting feature, we call historical blast. So when people sign up, we say, okay, add all the patients. And of course, as you can imagine, the back end is HIPAA compliant and end-to-end encryption and all those things, and that is required. I mean, otherwise you go to jail in this country anyway. So we download that and then we start to ask them about their experience the last time they had, and then they request them to write reviews. Some new clients will say, no, I just want to the patient who have been with us for 1 year. Some would say all time, whatever. So we are very agnostic about that. Doing that, they start to get a feel for what was happening, and they also start to get reviews.
Yeah.
What I've noticed that if the survey request goes from you, hi AJ, this is Michelle. Thank you for coming. How do you rate your experience? Right, 0 to 10. And if I say 9, it's like, thank you. Can you write anything about the experience? At that point, here's a link of my Google or Yelp. Or Yelp you cannot do because Yelp is a, they have a lot of restrictions. So
Mm,
you have to get around that restriction for Yelp, which we have. So, but you can say, here's a Google link. Would you mind writing a review for me? And you'll be surprised when it goes from you versus, for example, if it was your front desk person, it's day and night. So that's what we suggest to our clients, that the message should go from the doctor. So this, 400 doctors, we are not sending it from the big organization. It goes from doctor, and the reviews also are for doctors.
yeah.
Now, there are some practices who will come in and say, I don't want to build doctor's review. I just want to build the practice review. I think it's short sighted. But
Huh.
again, like you said in the very beginning, customer is king. So we tell them why they should be doing some. We even have a process where we can split half of the people, we drive them to the practice review side, half of the people we drive them to the providers. But if someone says, no, no, I just care for practice, then that is typically the owners. You know how there are some non-healthcare owners of the healthcare businesses.
Right.
They are like, oh no, doctors come and go, but my practice, my business is here, so I just want the business thing. But what they don't realize is people come to the website, they see, oh, the practice is well ranked, and then they see which doctor they are going to see, and they're going to check the doctor's reviews again. So it's a typical process. You have to take care of both your practice and your individual reviews.
Oh, that's so interesting, and I never thought about that before. So the way that my Google reviews are set up for my practice is it's for the practice. And I always ask my associate, can you tell me, do you have any really satisfied patients? And I'll send them an email asking them to leave a review for you. And sometimes it works and sometimes it doesn't. So it sounds like that would be more effective if it came from her.
Yeah,
Okay,
whoever is the provider, it should go from.
that makes
So,
sense.
yeah, if I went to see you, it goes from you. I'm much more likely to respond to it
Mm.
versus if I saw you and I get it from another name. Again, it's kind of interesting because you would think that people remember the name of the practice. The relationship is with the doctor, not with the practice anyway.
Yeah. So we do not have separate reviews for me and Melody. I wonder
Yeah,
though
you should definitely.
if we should separate them somehow. So would we separate them as providers, like set us ourselves up as providers on Google, located
Yeah,
inside the practice?
definitely.
Ah, I see. Okay.
Yeah.
You know, what's so funny is I asked a couple patients if they'd leave Melody a review, and one of them came in person with a handwritten review. He was like, I don't have a Gmail account, so I can't do this on the internet. And he gave it to me and he's like, can you do something with this? And I was like, well, I'll put it on the website and I'll put it under Melody's About page. It was such a nice review, and I was very touched that he handwrote it and brought it in person. I taped it up on the wall in the laundry room.
Yeah, this something is really nicely done. I would just buy a $1 frame, put it in the frame and hang it in where the patients are sitting
Oh,
there.
yeah. Okay. That's a great idea. I like that. I do have one more question for you, and that is
Sure.
what is your definition of success?
So I will tell you from my business, and it translates to any business. For me, the success is, am I under promising and over deliver? If my clients come in with the expectation of, for example, can I get 10 new patients? And if I'm doing 15, When the client says, "We're thrilled, you're doing it, I'm happy," to me, that is the success is all about. If in the business, life is the whole different ballgame, right? That's how I engage success is how many thrilled clients I have.
Very nice. Yeah. I'm also a big fan of under promise, over deliver because I agree
Yeah.
it's so nice when people are pleasantly surprised by how wonderful a service is or an
Yeah.
experience. That's a really good feeling. Well, thank you again so much for your insights and for spending time with me today. How can people find you? How can they get in touch with you or work with you?
The best thing to find me is actually go to the website. It's www.g as in Gloria, M as in Mary, R as in Rachel, web team, T as in Tom, EAM
Hmm.
dot com. That's the ideal way to reach out because anyone would be able to see what we offer, what is our philosophy. And then if someone is looking only for reputation management, which, like I said, 95% of my clients are looking only for reputation management, then just go to repugen.com. It's Repug as in Gloria, En as in Nancy.com.
Perfect. Well, thank you again so much.
Thank you, Michelle. Very good talking to you, and good luck with your practice. I mean, you're doing a great job. We do talk to a lot of acupuncturists, and so good thing that you are trying to help them with the marketing.
Oh, thank you. I appreciate it. Don't forget to check out our sponsor, AccuHub. They provide US based, highly trained remote receptionists specifically for acupuncture clinics, so you can spend less time on admin tasks and more time focusing on what matters most: your patients, your family, and your life. With flexible month to month service and no contracts, AccuHub rates range from just $5 to $8 per hour, depending on your clinic size. Learn more at acu-hub.com, and the link is in the show notes. Or feel free to reach out to me if you have questions about my experience. My email again is michelle@michellegrassick.com. As always, thank you for being here. Can't wait to talk to you next time.